I'm Gene Ritzentaylor, the Director of Human Resources for the Catholic Diocese of Arlington, and I'm here today to talk to you a little bit about healthcare reform and your diocesan health plan. In the coming weeks and months, debate about the merits of healthcare reform are likely to intensify, and for many of us, deciphering reform's terminology and navigating the bewildering array of options will be daunting tasks. Starting with the recent mailing to your home, and continuing over the next several weeks with this presentation, employee meetings, and additional mailings, the Employee Benefit Office will try to equip you with sufficient information to make the best healthcare decisions for you and your family. In this presentation, we'll help you better understand healthcare reform by discussing two of its key components. The mandate that requires all employees to purchase health insurance by January 1, 2014, and local state-based health exchanges that began accepting enrollment for coverage effective January 1, 2014 or later. We will also give you some tips on how to compare the diocese plan to the options available to you through the local health exchanges. These tips should also be applicable to assessing other options, for example, a plan offered by your spouse's employer. Let's begin our discussion with reform's first key component, the individual mandate. Effective January 1, 2014, reform's so-called individual mandate will require most employees to purchase health insurance. Employees may comply with the individual mandate by purchasing insurance from several sources, including an employer's plan, Medicare, a plan purchased either directly or from a broker through the individual market, or a plan available on a local exchange. Employees that are not exempt from the individual mandate and that fail to buy a qualifying plan will pay a tax penalty that increases annually. In 2014, the penalty will be up to $285 per family, or 1% of family income, whichever is greater. In 2016, the penalty can be as much as $2,085 per family, or 2.5% of family income, whichever is greater. Now let's turn to the second key component of healthcare reform, local health exchanges. Local state-based health exchanges have begun accepting enrollment for coverage with an effective date of January 1, 2014 or later. A local exchange doesn't itself provide insurance. It is simply an online marketplace where you can comparison shop among the plans offered by the exchange, apply for a federal subsidy to offset the cost of exchange coverage, determine whether you or your family qualify for a public health program, such as Medicaid or the Children's Health Insurance Program, and purchase a health plan. Maryland and the District of Columbia will each run its own exchange. The federal government will run Virginia's exchange. Insurers participating in an exchange must organize their plan offerings into 4 metal tiers based on the cost sharing they require. The exchange assigns to each tier an actuarial value, a term that refers to the share of healthcare expenses that a plan in that tier is expected to cover on average. For example, a bronze plan is expected to cover about 60% of covered expenses. Plans in each of the 4 tiers will vary by premium, deductible, copay, coinsurance, the size and composition of its network, and how it treats prescription drugs. Plans may vary in other ways as well. Catastrophic plans may also be offered, but only to individuals under age 30 or individuals of any age who can't find an exchange plan that costs less than 8% of their annual income. 2 types of sliding scale subsidies will be available to eligible low-income individuals and families. First is a tax credit that is available to individuals and families who earn between 100% and 400% of the federal poverty level. A tax credit caps the percentage of income that someone must spend to purchase a plan. The amount of the credit is based on the second lowest cost silver plan in the exchange, and the credit can be applied to the premium for any plan in the exchange except for the catastrophic plan. The second type of subsidy is available to individuals and families who earn between 100% and 250% of the federal poverty level. This cost-sharing subsidy reduces out-of-pocket costs through lower deductibles, lower co-payments, and lower coinsurance at the point of service. To receive this cost-sharing subsidy, an individual or a family must enroll in a modified version of a Silver plan. These sliding scale subsidies are available only for plans that are purchased through an exchange. Now that we understand the two key components of healthcare reform, the individual mandate and the local exchanges, let's review the definitions of some key terms. You will need to understand these terms in order to navigate successfully the options that are available to you. A premium is the amount that you pay to purchase a plan. You generally pay your premium on a biweekly or monthly basis, and the amount of the premium is fixed for the plan year. A deductible is the amount that you pay before your plan begins to pay. However, not all covered services are subject to a deductible. Coinsurance is your share of the cost after you have met your deductible. A coinsurance is usually expressed as a percentage of the allowed amount. A copayment is a fixed amount that is usually paid at the time of service. Copayments typically vary by the type of service provided. For example, $25 for an office visit or $30 for a prescription drug. An out-of-pocket limit is the most that you will pay during a plan year before your plan begins to pay 100% of allowed charges. Your out-of-pocket limit doesn't include your premium, any differences between a provider's charge and the amount allowed by your plan, or any non-covered services. Now, let's review how these terms apply to the operation of the Diocese plan. The Diocese offers a consumer-directed health plan that promotes wellness and prevention by exempting from the deductible age and gender-specific screenings and immunizations, preventive drugs, and diabetic supplies. The plan pays these preventive services and supplies at 100% for all plan participants. The plan also provides cash incentives to report specified health information and to complete an individual health assessment. The plan deposits these earned incentives into a health savings account. A health savings account helps participants pay for their current healthcare costs with before-tax dollars and to save for future healthcare costs. Eligible participants may also make before-tax or after-tax contributions to their accounts subject to IRS-defined limits. Participants own their accounts. Consequently, account balances carry over from year to year, and participants take their accounts with them when they leave the diocese. Participants pay an in-network deductible of $1,250 or $2,500 before the plan begins to pay a benefit. After meeting the deductible, participants pay a 20% coinsurance for medical services and a copayment for prescription drugs. Participants may pay their deductibles, coinsurance, and copayments with before-tax HSA dollars or after-tax out-of-pocket dollars. When participants have paid an in-network out-of-pocket maximum of either $2,200 or $4,400, the plan pays all covered services at 100%. Participants continue to pay a copayment for prescriptions. All health insurance policies available through the federal and state exchanges are required to include coverage for products and services contrary to our beliefs as Catholics. For example, contraceptives, abortion-inducing drugs and devices, and sterilization procedures. Our plan will maintain its status as a grandfathered and religious plan, exempting it from covering these products and services. These exemptions differentiate our plan from most employer plans and separate us from all exchange plans. It may be that for some of you, in order to obtain health insurance for you and your family, have no other option than to purchase one of these exchange policies. If so, then clearly you should not use the morally objectionable components covered by the insurance program. Moreover, we encourage you to make known to your elected officials your objections to this public policy that requires you to purchase objectionable insurance coverage and to work in a prudently appropriate manner to effect a change in that policy. At this point, we have deciphered healthcare reform terminology and have a good idea of how the exchange plans operate and the diocese plan operates. So, how do you go about deciding which option is right for you and your family? After all, your medical needs are unique, as are your tolerance for risk, your current cash flow, and your savings. Generally, and I emphasize generally, an employer plan will be your better bet because most employers, like the diocese, heavily subsidize your premium. Furthermore, you can generally pay your employer premium with before-tax dollars, something you cannot do if you purchase a plan in the exchange. Some employers, again like the diocese, offer a health savings account. Others may offer a flexible spending or health reimbursement account. Such arrangements allow participants to pay for their out-of-pocket expenses with before-tax dollars. Again, something you cannot do if you purchase a plan through an exchange. If you're still not certain which option is best, ask yourself this threshold question. How much financial risk am I willing or able to assume? Begin by considering your budget for the upcoming year and the healthcare services you anticipate using. How many visits to the doctor do you expect to make? Do you suffer from a chronic illness like asthma, diabetes, or arthritis? Do you use one or more maintenance or specialty drugs? How much financial protection do you need if you suffer a serious accident or encounter an unexpected health problem? You can choose to pay a lower monthly premium so that when you need medical care, your out-of-pocket costs are higher, or you can choose a higher monthly premium, and when you use medical care, your out-of-pocket costs will be lower. Begin your analysis with the premium. What amount will fit your monthly budget? Exchange premiums can vary by the plan you choose, where you live, your age, whether you're a smoker or a non-smoker, and the level of coverage that you select, individual only or family. The diocese premiums vary only by our 3 coverage levels: employee only, employee plus 1, or family. For eligible individuals and families, an exchange provides sliding scale premium subsidies and cost-sharing subsidies based on income. The diocese plan subsidizes the same percentage of premium for all 3 levels of coverage, 67%. The plan does not provide any cost-sharing reductions. Finally, you will pay exchange premiums with after-tax dollars. You will pay diocese premiums with before-tax dollars. Although premiums are important, they represent only a portion of your total financial exposure. You will also want to take into account a plan's cost-sharing expenses. Unlike premiums that are predictable, cost-sharing expenses vary widely depending upon how and how often you use a plan. We've already examined the primary cost-sharing components: deductibles, co-payments, co-insurance, and out-of-pocket limits or maximums. Keep in mind that exchange plans can charge out-of-pocket maximums as high as $6,350 for an individual and $12,700 for a family. The diocese plan charges an in-network out-of-pocket maximum of $2,200 for an individual and $4,400 for employee plus 1 or family coverage. Exchange plans don't include the cash incentives and the health savings account that are available from the diocese plan. Finally, examine carefully the size and composition of the network that a plan uses. Does the network contain a sufficiently wide selection of providers and facilities? Are there enough of the types that you need? Primary care doctors, specialists, hospitals, urgent care centers, or labs? Are providers and facilities easily accessible? Are they close to where you live or where you work? Does the network contain all of the providers with whom you have already established a relationship? Is there an out-of-network benefit available? If so, is there a lower reimbursement for services received out-of-network compared to services that are received in-network? We've only scratched the surface of healthcare reform, and there are likely to be other factors unique to your situation that you will need to take into account before making your decision. Nevertheless, if you start with the tips we've presented, you should be well on your way to obtaining a plan that you need. A plan that offers a network with enough providers and facilities, that addresses the unique medical needs of you and your family, and that does so at an affordable cost. If you need more information, links to all local exchanges can be found at www.healthcare.gov. Information about the Diocese plan can be found at www.arlingtondiocese.benergy.com. You may also call the Employee Benefits Office at 703-841-2588 or send them an email at ebo@arlingtondiocese.org.